Been 2 months now since the 988 hotline launched, and South Carolina's only suicide call center is working now to keep up with the demand.
Today, state lawmakers got an update on the needs of that center. As News 19's Becky Buds reports, more state funding could be on the way.
Getting help during a mental health crisis is now as easy as dialing 988. The new 3-digit number replaced a longer 1-800 number tied to the suicide prevention lifeline. And South Carolina's only call center is working around the clock to answer the influx of callers.
We want to blast the 988 number all over, but we also want to be responsible.
Kathy Eckert is the director of crisis intervention services at Mental Health of America in Greenville. She says calls increased 101% in the week after the hotline's July 16th launch. Overall, calls are up 65% from last year. The center is answering 75% of them, but the goal is 100%.
We know our resources better than anybody else. We know policies and procedures in the state better than out of the state.
Eckert explains the center is surviving off grants and donations and is in need of a steady source of funding.
If we had the funding, we would like to hire probably at least 10 full-time people.
On Wednesday, state lawmakers and agency leaders got an update on what the call center is facing. They've already approved $1.3 million in this year's budget for a second call center in Charleston that's expected to be online early next year. The State Department of Mental Health is asking for more money in next year's budget to fund someone to answer the call, someone to respond, and a safe place to go for care.
988 and our mobile crisis teams and our efforts for suicide prevention, we're looking for $11 million.
Efforts people like Miranda Beaver, who lost her uncle to suicide in 2013, supports.
I hope that one day we can talk openly about suicide without stigma and that everyone will understand the importance of this cause.
Reporting in Columbia, Becky Buds, News 19 WLTX.
Well, the state of South Carolina has mobile crisis units in all 46 counties. There are 2 mental health crisis stabilization units, with 1 on the way in the greater Columbia area. Now, the latest numbers show 1 out of 5 South Carolinians will experience mental illness each year. About 706,000 adults in the state live with mental illness, more than 5 times the population of Charleston. 53,000 teens aged 12 to 17 in South Carolina live with depression. A couple of years ago, nearly 38% of adults in South Carolina reported symptoms of anxiety or depression. And according to the National Alliance of Mental Illness, 1 in 4 people with serious mental illness will be arrested in their lifetime. That leads to over 2 million jail bookings of people with serious mental issues yearly. That data also states that 7 in 10 kids in juvenile justice systems have a mental health condition.